I'm introducing to you a simple but highly effective exercise. And you wonder what it is. This exercise cuts across gender. This exercise cuts across generations. So the young, the middle-aged, and the old can actually use it. And everyone can benefit from it. So stay with me on this podcast and watch till the end, because I'll be telling you what this exercise is, how to do this exercise, and you'll come back to share the testimony in the comment section. My name is Dr. B, and I promote health literacy so that you can make health your most important asset. If you're a newcomer to this podcast, you are welcome. Kindly subscribe. And if you've been watching this podcast from time to time, click subscribe. It doesn't bite. And also the notification button so you can be aware when there is a new episode on the channel. So what is this simple but highly effective exercise? It's the Kegels exercise. Yes, it is a pelvic floor strengthening exercise. And you see, that's why it cuts across every age category. So for the young woman, it's effective because it is preventive. For the older woman, it is actually curative at that point. It is more of an intervention. The exercise helps to, take care of whatever has happened. The same thing with the man. And you wonder, what exactly is this about? Hang on. For the woman, with age, the pelvic floor muscles get weak. Coupled with the years of pregnancy and childbirth, the pelvic area gets weak. And when they become weak, there are many things that could happen. Because of the laxity, sexual intimacy might not be as pleasurable for her anymore. Some women start to experience urinary incontinence or fecal incontinence. Yes, you want to pee, and before you know what has happened, the underpants are already wet, no matter how hard you try. The same thing when they want to poop. And this is not in any way convenient. But you can take care of it with the Kegels exercise. Also in men, as they age, some start to have erectile dysfunction. They ejaculate prematurely, and for some, erection is just very weak. For some men, post-prostate surgery, there is also erectile dysfunction. These are the things that Kegels exercise can take care of. Yes, so I want you to sit tight, because now I'm going to teach you how to do the Kegels exercise. In doing the Kegels exercise, you are tightening the muscles of the pelvic floor, and you simply do it by sitting upright like I'm doing right now, and you tighten the muscles around the anus, and for a woman around the vagina. It's like you're pulling it up and you actually feel it. So you do this, tighten, you count aloud up to 3 so you're not holding your breath. 1, 2, 3, and then you relax. 1, 2, 3. You tighten. 1, 2, 3. You relax. 1, 2, 3. So I've done 2 cycles. The recommendation is that you do about 10 cycles in the morning and 10 cycles in the evening. For those who might find it very difficult to understand how to really get it right, one of the simplest way to do this is by stopping your urine while urinating. Sit down in the washroom, you start to pee, and then you stop. When you stop, you count 1, 2, 3. So the way you tightened your muscles that helped you to stop is exactly what you will do when you're sitting and trying to do the Kegels exercise. The stopping your urine consistently is not recommended because it can promote urinary tract infection, and we don't want that happening. But you can learn how to do it effectively by stopping your urine just the way I taught you. And when you've mastered it, you can now start to do it sitting upright on the chair. You do this consistently for weeks, you'll find the difference. And when you feel better in your pelvic floor area, make sure to come back and post a comment and tell us how it went. And if, for example, you're having challenges with it, please also post in the comment section. And I want to say that this is a recommendation, and it only works when the incontinence or urinary or fecal incontinence or erectile dysfunction or prolapse is due to pelvic floor muscle weakness. Kegels exercise will not take care of those conditions if it is not due to the pelvic floor muscle weakness. So at that point, you might need to see your urologist or your gynecologist. But Kegels exercise is simple but highly effective. It is preventive and also curative. I hope you've learned something new on this channel today. Remember, your health is your greatest asset. Until the next episode, I remain Dr. B. Take care and bye-bye.